Majid, great to see you.
Thank you, same here.
So Medtronic have a publicly avowed strategy of coming into the growth markets. They say the growth markets is their biggest opportunity long term. How do you penetrate these markets?
Well, you're absolutely right. It does present itself to be the single largest opportunity for medtech industry over the long term. And that's due to the low penetration rates we see across the emerging markets, where you have billions of people with less than 1% of penetration rates across the board. So in order to address this challenge, you would need to be innovative at many ends and at different levels within the healthcare delivery system and within the device. But you start by being first there. You localize your teams. You make sure that you address the current and local needs of these markets. And that can only be done by having your own team support firsthand the needs of the patients on the ground. But then do you build focused, or do you put focused investments to build capacity where you would eventually produce physicians that have high skill sets, clinicians that can support these physicians to do the necessary treatments? Do you do focused investments in infrastructure and partner with groups that have a common interest in providing more accessibility into the system? And in some healthcare systems where probably accessibility is available to a certain extent, how do you keep that system efficient, and how do you contribute into making it continuously providing high quality output while maintaining its cost to avoid the challenges we see across the world right now? So emerging markets is very dear to the company. The geographical expansion into emerging markets is one of the main growth pillars to Medtronic, and we will continue to focus on putting the necessary investments to help reach these patients and give them access to our life-saving therapies to treat all of their critical illnesses.
That's great. So you're saying to come into these markets, you really need local presence. You need to really help capacity build doctors and capacity build infrastructure.
Absolutely. Yeah.
So that takes me to another part, which is innovation. Clearly you are a world leader in devices, but how do you see device innovation, business model innovation, and potentially even digital innovation being important to your strategy?
Well, when it comes to device innovation, yes, we have been world leaders in many of the therapies we do. And what the mindset in emerging markets is, can we provide devices that are less invasive, devices that can be implanted easier, and by using broader physician communities? Can we also provide simple implants or accessibility to procedures that healthcare professionals or even social workers can provide to communities that do not have the capacity, whether it's the infrastructure capacity or the physician capacity, and kind of shift the task into their hands to serve these communities? These are all devices and technologies that we have in mind, and that will keep on coming. Probably will serve the entire population of the world, but would have the biggest impact on emerging markets. When I look at business model innovation, we will still be strong in providing latest high-end technologies that matter to the patient, but we need to now contribute a lot more into having solutions that would allow accessibility of these patients to these devices and these technologies. Solutions that will make it easier for healthcare systems to address the challenge of accessibility and provide consistent high quality across the board. And then if I look at the connectivity and IT and the use of that to try to keep the patient connected into the healthcare system, whether to the physician or to the hospital, without having the patient come into the system back again, which is a major contributor to the savings and to keeping the system optimum in terms of cost through using connectivity and technology, where you can monitor the patient at home and they can only come back to the system if the data shows that that is necessary. You can do that also for the chronic diseases like diabetes, where the diabetes patient would require continuously a continuous support cycle throughout their life. And again, you can maintain that through remote monitoring, which we have in Medtronic, that would allow us to also bring in more support to the patient when the data shows that that is necessary. I think these are factors when you look at business model innovation or device innovation or using IT to help keep the system lean, which would allow for more access.
Well, that's fabulous. You've got innovation in almost every aspect of your business, which I know we as partners with you, and we're delighted to have you as partners in our health strategy. We really hope to implement this across our markets. What do you see as a measure of success of our partnership over the next 5 years?
What I'm sincerely hoping, and I think we have a great chance at it by working together, is to be able to treat 1 million patients in Sub-Sahara within the next 5 years. If we do that, that's about 10 times more patients than what we do right now or what we would have done through our traditional business development or therapy development in that area. And by having the infrastructure that Abraaj and the fund is able to build in these major hubs within Sub-Sahara, I'm pretty sure that that number is very achievable only on the therapies that Medtronic can serve. And it's vast. It's probably 70% of the therapies that lead to death if not treated. So the golden number for me is 1 million patients, hopefully within the next 5 years. And I'm counting on Abraaj. I know that Medtronic's leadership is doing the same way in order to help us access these patients in Sub-Sahara.
Well, I know we are really excited and we feel it's our duty to create an impact for these populations.
Great.
And 1 million people in Sub-Sahara is a big goal, but we will get there.
I am very confident we will.